Barts in the London School of Medicine and Dentistry, part of Queen Mary University of London, is a leading medical school with a diverse student body. Its history can be traced back over 200 years, to a time when life as a medical student was very different indeed. Join us on this brief history of the medical student to find out what has changed and what has stayed the same. Barts in the London was formed in 1995 from the former medical colleges of St Bartholomew's Hospital and the Royal London Hospital. The archives of these colleges are held by Barts Health NHS Trust Archives and Museums and tell the story of student life through the centuries. Until the 19th century, medicine was roughly separated into three branches: physicians, who advised and prescribed medication, apothecaries, who made up and dispensed these remedies, and surgeons, who performed operations and other physical procedures. Traditionally, physicians were taught at universities, while surgeons learnt their craft by apprenticeship. Physicians and surgeons working at hospitals such as Barts in the London could take on private pupils or apprentices. Pupils would learn by practical observation, known as walking the wards of the hospital, and by attending lectures and demonstrations. As space in the hospitals was limited, physicians and surgeons often gave these lectures in their own homes. Subjects taught included materia medica, what we would now call pharmacology, botany, anatomy, physiology, midwifery, medicine and surgery. Medical education started to become more formally organised in the 18th century. In 1783, the physician James Maddox and the surgeon William Blizzard persuaded the London Hospital's House Committee to establish a medical school. They argued that this would give the students a theoretical education along the lines of a university, combined with practical experience in the hospital itself. The committee agreed, and although it couldn't provide any money, it made land available near the hospital in Whitechapel for the building of a lecture theatre and museum. When these opened in 1785, the London Hospital Medical College was the first purpose-built medical school in England. In 1911, the London Hospital also established a dental school. In 1965, a purpose-built dental institute was opened, shortly before a certain Roger Taylor of Queen studied there. The first reference to pupils or apprentices working at St Bartholomew's Hospital occurs in 1662. They weren't always a welcome presence. In 1664, the hospital's governors complained that the students were causing an obstruction to the patients with their bold and saucy carriage. In 1791, the surgeon John Abernethy persuaded the governors to build a lecture theatre. However, the Medical College of St Bartholomew's Hospital did not achieve formal recognition until 1822, and Abernethy had to convince the hospital that the students were more of a help than a hindrance. At this time, students at both colleges could choose their own curriculum. As well as walking the wards, they could attend whatever lectures they wanted, and could even attend lectures at different hospitals or private medical schools. Students would purchase admission tickets to any course they wanted to attend, paying the lecturers directly, and they would get a certificate of attendance at the end of the course. As well as observing living patients, the students would learn about anatomy and disease by studying preserved specimens at the college's pathology museums. Students were also taught by observing or carrying out their own dissections, as is still the practice today. During the 19th century, medicine became increasingly professionalised and qualifications were more formally controlled. Students could qualify by taking the conjoint diploma of the Royal College of Surgeons and the Royal College of Physicians, or they could proceed to take the degree of MBBS. The usual period of study was 4 years, extending to 5 years after 1892. The fee for 5 years of study was between 150 and 160 guineas, or between £13,000 and £14,000 in today's money. Medicine was a male-only domain, and women had a long struggle to gain admission to medical schools. The first woman medical student at Barts was admitted in May 1850. Elizabeth Blackwell had just become the first qualified female medical practitioner, having taken her medical degree in America, and she studied at Barts until July 1851. While Blackwell apparently received a warm welcome, this did not open the doors to more women. In 1865, a student called Ellen Colborne had to abandon her attempt to study at Barts when male students demonstrated against her presence. There were no further women students at Barts until 1947. Elizabeth Garrett Anderson, the first woman to qualify as a medical practitioner in England, did part of her medical training at the London in the 1860s, although officially in the guise of a surgical nurse. In 1876, she attempted to persuade the London to accept women students, but she was unsuccessful. Women were allowed to train as doctors at the London between 1918 and 1923, due to the shortage of medical staff and students after the First World War. However, after then, women were not permitted entry again until 1948. Although we don't know when the first non-white students entered either Barts or the London medical colleges, some notable early black students include Benjamin Quorty Papafio, who studied at Barts in 1882 and was the first Ghanaian to qualify as a doctor, and Celestine Edwards from the Caribbean island of Dominica. Edwards enrolled as a medical student at the London Hospital Medical College in April 1890. He was also a passionate campaigner for human rights and spoke at meetings all over Britain about the lynching of black people in the United States. For most of their history, Barts and the London medical colleges didn't provide accommodation, and students would have to arrange their own lodgings. In 1843, however, Barts founded a residential college in what is now Little Britain, West Smithfield, to enable students to live within the walls of the hospital. In 1933, student accommodation moved to College Hall, Charterhouse Square. The London Hospital Medical College established a students' hostel in 1911 on Philpott Street in Whitechapel, and opened a second hostel on the Whitechapel Road in 1924. Early medical students had to arrange their own meals and often ate in public houses. Later, both colleges provided dining halls and in-house catering. This wasn't always a popular choice. Complaints books, which survive in St Bartholomew's Hospital archives, contain reports of beef which was unfit for human consumption and beetles in the students' food and drink. While extracurricular activities are an important part of student life today, this wasn't always the case. Before the 1890s, the medical colleges had no official clubs or societies, and there was no organised socialising outside the colleges. One exception was the Abernethian Society, which was founded at Barts in 1795 for the reading and discussion of medical papers. In the 1850s and 60s, sporting clubs such as rugby union, cricket, athletics, amateur boxing and association football were set up, as well as musical and dramatic societies. These were organised by the students themselves, and there was little funding for these activities or rooms to host meetings in. Things became more organised in the 1890s when a number of student societies combined under one coordinating body. The Amalgamated Clubs of St Bartholomew's Hospital was formed in 1892, and, not to be left behind, the London Hospital Clubs Union was formed the following year. At the same time, student newspapers were established. St Bartholomew's Hospital Journal was set up in 1893, and the London Hospital Gazette followed a year later. These gave the students a voice, and contained anything from medical articles and reports from clubs and societies to poetry and cartoons. Today, Barts and the London School of Medicine and Dentistry has one of the most diverse student populations in the UK, and our archives continue to collect records from the student body which reflects this. We hope you've enjoyed this video. You can find out more about Barts Health Archives and Museums via the link below, and follow us on Twitter and Instagram.